It's snowing outside. Endometriosis, PCOS, IBS. Let's talk about it. So endometriosis is a chronic illness that is defined by uterine-like tissue growing outside of the uterus. So it causes severe pelvic pain, heavy bleeding, irregular periods, painful periods. There's no cure. It's typically diagnosed by a laparoscopy. PCOS stands for polycystic ovary syndrome. It is a hormone disorder. It's characterized by irregular periods, weight gain, excessive hair growth, and I believe acne. It's diagnosed through recognition of clinical symptoms, blood tests, and ultrasounds. Now, IBS stands for irritable bowel syndrome. It's a gastrointestinal disorder that is characterized by changes in bowel habits, bloating, gas, abdominal pain. It's typically diagnosed through a detailed review of symptoms. I personally had to get a colonoscopy to confirm when I was suspicious that I had IBS. Not fun, not cute. So even though there are distinctions, there are clear similarities between all of them. For example, endo and PCOS are both defined by irregular periods and lead to a higher chance of infertility. IBS and endo are both linked to nausea and painful bowel movements. All three of them are linked to stomach pain, cramping, bloating, irregular bowels. It's just like, you know? So you can see how people will get confused. And that's why it's so important to track your symptoms. Write them down, because that could be the catalyst between deciding the difference between, do you have PCOS? Do you have IBS? Do you have endo and IBS? PCOS and IBS, like, you know? So do yourself that favor, love, and write it down, okay? Write it down so that when you go to the doctor, that y'all not looking at each other like. But I found this little graphic that I'm gonna throw up so y'all can see, because it just helped me explain this to y'all. Regardless of whether you have one, the other, all three, make sure you are advocating for yourself. Make sure you are tracking your symptoms. Make sure you are listening to your body. Make sure you are recognizing what feels good, what makes you feel worse, what feels normal, what feels okay, what your limitations are. Listen to yourself, and then speak up for yourself, please. If you have the ability, please. I wish you nothing but love and light, babies.